Every minute of every day, somewhere in the world, someone new is infected with HIV. That's why it's so important to know the facts about this virus. Because while there's still a lot that we don't know about HIV, we do know many things people believe about HIV are actually wrong. Today, we'll uncover the truth about HIV, its symptoms, prevention, and the myths that put lives at risk. So let's start with the basics. What is HIV? HIV stands for Human Immunodeficiency Virus. It attacks the body's immune system, specifically the CD4 cells, which help coordinate the immune response. When HIV enters the body, it uses an enzyme called reverse transcriptase to turn its RNA into DNA. This allows the virus to integrate itself into the host cell's DNA, hijacking the cell's machinery to make copies of itself. As more and more CD4 cells are destroyed, the body becomes increasingly vulnerable to a variety of opportunistic infections and cancers that would normally be easily fought off by a healthy immune system. The damage caused by these infections can lead to the symptoms associated with AIDS, the most advanced stage of HIV infection. HIV is a sneaky virus. At first, your immune system might be able to fight off the infection, but over time, it begins to weaken until eventually the virus overwhelms the body. It's not uncommon for people to have HIV for years without knowing it because early symptoms can be mild or go unnoticed. Early signs and symptoms of HIV may include fever, chills, rash, joint pain, sore throat, or swollen lymph glands. These symptoms resemble those of a bad case of the flu or another viral infection. However, as the virus progresses, it begins to take a more significant toll on the immune system. People with HIV are susceptible to a wide range of health problems that don't typically affect those with healthy immune systems. Some common conditions that may arise include persistent diarrhea, weight loss, pneumonia, tuberculosis, and certain types of cancer. These symptoms and health issues serve as indicators that the virus is progressing and the immune system is weakening. It's crucial during this stage to seek medical attention promptly to slow the progression of the disease. With timely intervention, people with HIV can live long and fulfilling lives. Thanks to antiretroviral therapy, ART, which helps to suppress the virus and prevent the development of AIDS. Now that we know what HIV is and some of its symptoms, let's move on to transmission. How does HIV spread? The virus can be passed from one person to another through certain bodily fluids, including blood, semen, vaginal fluid, and breast milk. It can also be transmitted from a pregnant woman to her baby during pregnancy, childbirth, or breastfeeding. Here are some of the most common ways HIV is spread: unprotected sex, sharing needles or other drug paraphernalia, receiving contaminated blood transfusions and from mother to child during pregnancy, childbirth, or breastfeeding. Now that we know how HIV is transmitted, let's talk about prevention. There are several things you can do to protect yourself from getting HIV. Practice safe sex by using condoms or dental dams correctly every time you engage in sexual activity. Don't share needles or other drug paraphernalia. Get tested for HIV and other sexually transmitted infections regularly, especially if you're sexually active and have multiple partners. And if you're a pregnant woman living with HIV, talk to your healthcare provider about ways to reduce the risk of transmitting the virus to your baby. These are just a few simple steps that can make a big difference in preventing the spread of HIV. Remember, knowledge is power. By understanding how HIV is transmitted, you can take the necessary precautions to keep yourself and others safe. Now that we've covered the basics, let's move on to myth busting. Despite the progress we've made in understanding and treating HIV, there are still many myths and misconceptions surrounding the virus. Let's explore some of the most common myths about HIV. Myth No. 1. People often believe that HIV can be transmitted through casual contact like hugging, shaking hands, or using public restrooms. This is false. HIV is not spread through casual contact. The virus is very fragile outside the body and cannot survive on surfaces or in the air. It's also not transmitted through saliva, urine, or feces. Myth No. 2. Some people believe that HIV can be cured by taking certain medications such as antibiotics. This is also false. Antibiotics only work against bacterial infections, not viral infections like HIV. There is currently no cure for HIV, but with proper treatment, people with HIV can live long and healthy lives. Myth No. 3. Many people believe that having HIV means you will definitely develop AIDS. While it's true that HIV can lead to AIDS if left untreated, this is not inevitable. With early diagnosis and treatment, people with HIV can effectively manage the virus and prevent it from progressing to AIDS. Myth No. 4. Some people believe that women are more likely to contract HIV than men. While the risk of varies among different populations, it's important to remember that anyone who is sexually active can get the virus regardless of gender. In fact, globally, men account for around 3/4 of all adults living with HIV. Myth No. 5. Another common myth is that if you have HIV, you must have engaged in risky behavior. This is not true. Anyone can contract HIV regardless of their sexual orientation or behaviors. It's important to remember that the virus can also be transmitted through blood transfusions or from mother to child during pregnancy or breastfeeding. These are just a few examples of the many myths and misconceptions surrounding HIV. It's important to separate fact from fiction when it comes to this virus so that everyone can take the necessary precautions to protect themselves and others. By dispelling these myths, we can create a more informed and compassionate world when it comes to HIV. Let's now discuss how to live with HIV. If you've been diagnosed with HIV, it's natural to feel a range of emotions from shock and fear to anger and sadness. It's important to remember that you are not alone and there are resources available to help you cope with your diagnosis. First and foremost, seek support from friends, family, or a therapist. It can be incredibly helpful to talk through your feelings and develop healthy coping mechanisms. Additionally, there are various organizations that offer support and guidance to people living with HIV. These organizations can provide you with valuable resources, connect you with others in similar situations, and help you navigate the challenges of living with the virus. Remember, a diagnosis of HIV is not a death sentence. With proper treatment and support, people with HIV can live long and fulfilling lives. In conclusion, HIV is a complex virus that continues to affect millions of people worldwide. It's essential to understand the facts about HIV, its symptoms, and how it is transmitted in order to prevent its spread and reduce the stigma surrounding the virus. By educating ourselves and others about HIV, we can create a safer and more compassionate world for everyone. So let's continue to learn, share our knowledge, and support those affected by HIV. Together, we can make a difference. Please remember that this video is intended for educational purposes only and is not intended to be a substitute for professional medical advice, diagnosis, or treatment. If you think you may have been exposed to HIV or experiencing symptoms of the virus, please reach out to a healthcare professional or visit your local health clinic for testing and guidance. Early detection and treatment are crucial for managing HIV and preventing the progression of the disease. You can find additional resources and support through reputable organizations such as the World Health Organization, the Centers for Disease Control and Prevention, and local HIV/AIDS organizations in your community. Take care and stay informed.